Well, thank you for joining us, everybody. This is going to be fun. We've got our Bigfork Edge of the Wilderness addiction and recovery conversation. We've got some stories coming from people who have experienced recovery, and we've got some of our professional help that we've got that will speak to how can we do this? How can we do this well? How can we as a community support people who are in recovery, and how can we really make a difference in our community? Really quickly, we are very grateful for SAMHSA. They are the ones who are providing the funding for this through the University of Minnesota. They allowed for Joey Jacobson and myself. Joey's the one who is the spearheading this whole idea, and we'll hear from her in just a moment. But we were able to get together over a couple days last fall in August of 2019 and really think about how we as individuals could make a difference. And so this idea right here is really the brainchild of Joey Jacobson and her thought process. And I am so excited for all of the thought and the expertise, even though I knowing her, she doesn't want to be called an expert, but the personal experience that she's gone through to bring the empathy to this topic. So Joey, why don't you take a minute and tell us your story and talk about how this whole project came about?
I sure will, and thank you for the introduction. My name is Joey Jacobson, and I am a change maker. In the fall of 2019, I was invited to take part in a retreat for Aiken and Itasca County, Minnesota leaders wanting to address addiction and recovery in our home communities. The retreat was sponsored by the U of M Extension Office entitled the Changemaker Project. At the retreat, I learned that one way to address problems is through community support. At the retreat, it is my hope that this discussion tonight, which is being recorded on October 20 of 2020, will be shared throughout various education venues, and that people who are addicted and seeking guidance in recovery will find hope and direction, and that their families will as well. Drug addiction and abuse takes its toll on all Americans, regardless of whether you struggle with addiction in a personal manner. The emotional and financial impacts affect every town, community, and state. I became interested in helping other families struggling with addiction because my son, John, was addicted to meth when he was about 17. I didn't know where to go for help. I didn't know what was wrong with him. I knew something wasn't right, but I couldn't define what the issue was. So I turned to his classmates and his friends and asked them if they knew something was wrong or what was going on with him, because they were with him on a daily basis at school. And they all said no. They all denied that anything was wrong. And so that's one thing I learned, is that it seems like peers don't narc on each other. And I think that needs to be somehow addressed, because they have firsthand knowledge of what's going on. From that point, I couldn't handle his behaviors anymore. I just didn't know what to do. And so I called law enforcement. And at that point in time, we did have law enforcement in Bigfork. Thank you, John. And he was taken out of the community to a place where he couldn't access drugs. And so eventually we took him to a treatment center, and because he was away from the using friends, he had an opportunity to do some insights and had time to become sober through the work that he did in treatment. And he's been sober ever since. And it's been a long time ago. So the purpose of this panel is to discuss the signs of addiction and the importance of talking to someone to get help. Two of the speakers that you will hear from have struggled with addiction and are now in recovery. And actually, we just have one person now to discuss this. And you guys are, they're my heroes. Anyone is brave enough to talk about their experience is terrific, because it can help somebody else. You will also hear from local healthcare professionals who have seen and worked with individuals in the clinical setting and will give their advice on how to address addiction. If this presentation helps to make change with just one person, this whole project will be worthwhile. And I thank you all for joining us. Thank you.
Thank you, Joey. That's a good way to get us started here. And as we continue on through this conversation, in just a moment, we're going to hear from Dave Warwick. I know the Changemaker process that we went through was really powerful. It talked about how we as individuals can see change, and many of us, there were many of us there at the retreat that were on both sides of this. Personally, I had never personally dealt with addiction in my life, but I've known people who have, and so now we get to hear from our friend Dave, who he's got a story to tell about how he came through this full circle. So, Dave.
I'm Dave Warwick. I'm a previous addict. I guess I'm still on the road to recovery. I'm fully clean and sober, but this all started for me in college. I had gotten kidney stones, prescribed Percocet. They had prescribed me way too much with way too many free refills. And then that devolved into a Vicodin addiction once I didn't have Percocet refills anymore. Then that turned into NyQuil once I couldn't find anywhere to buy Vicodin. This all mixed in with a bad breakup, and then an Adderall addiction to stay awake through work because I was taking so many pain pills and sleeping pills. But my thing was I hid it really well, and kind of like what Joey was talking about, where peers won't narc on each other. If you're peerless, it's really easy to not narc on yourself because you're not having those interactions, because you're pulling yourself away from social situations, either to be on drugs or, in my case, to be on drugs and to work a lot because I was working 2 full-time jobs and going to school. But then the Adderall was to keep me awake, and I never wanted to show any signs of being weak or to stop all the pain that I was in taking all the pain pills. And I did that for about 2.5, 3 years. The last year and a half of that, I was living in my car. And not really because I was poor, but I figured it was easier to save my money for my medicines if I wasn't paying rent on a house or paying utilities. So I was living in the back of a van parked at work or parked at school. And yeah, I did that for a while, and then I just got tired of throwing up every day, because that's the thing you don't think about when you're using, is all the little things that you normalize that aren't normal. So waking up and puking every day, or having to figure out where you're going to get your next little fix, depending on what it's going to be that day, if you're going to be able to get your hand on pain pills, or if it's going to be just NyQuil or what have you. Yeah, I got tired of throwing up every day. I got tired of coughing, got tired of headaches. And then I stopped, or I came to a point where I decided I had to stop. And that all came down to control. I had to plan out every minute of the day to where I was saying, like, okay, I'm waking up, or not even I'm waking up, even further than that. I'm setting my alarm, and then I'm setting my snooze alarm, and then I know I need to get my teeth brushed in the next 4 minutes. I need to take a shower in the next 7 minutes. And that was kind of how I put myself through the beginning month and a half of sobriety and being clean. At that time, I had also decided to move from California to Minnesota, try to get out of my environment and into an environment where I didn't know anyone except for I had an uncle up here. But yeah, I'm going to mute myself now so I don't interrupt.
All right, thank you, Dave. What a fantastic story of recovery, and just a story of hope for people who, if you're in that spot where you've been caught on painkillers or anything like that there is hope out there for you to see yourself to the other side of this. Next up, we have Dr. Heidi Korstad. I'm familiar with Dr. Korstad from our Bigfork community up here. Dr. Korstad is a retired family doctor who worked at the health care center here in Bigfork for 35 years. Her love for this community and its members is evident, and she's witnessed firsthand the ravages of drug addiction and alcoholism as it tears families and their community apart. Today, she's been invited to talk about the science behind addiction. And so, Heidi, why do people with substance use disorder compulsively seek and use them despite terrible adverse consequences?
That's an incredible question. And that's the one that people that aren't using drugs keep asking. They're going, wait a minute, people's lives get destroyed. Why do they keep doing this? And there's a lot of answers to that, but the short answer is that addiction is actually a brain disorder. And there's real changes to the brain and to the circuits and pathways, okay? The fact is that nerve cells in our human brain experience pleasure, and the nerve cells talk to each other through a substance called dopamine, okay? We get a little squirt of dopamine every time that we have something pleasurable happen. If you have a great meal, you get a little squirt of dopamine. If you have a nice conversation with a friend, socializing, we get a squirt of dopamine. If you have sex, you get a squirt of dopamine. And this signals the brain, it tells the brain, there's something really important happening here. We've got dopamine going on. And then the brain says, I'm going to remember this. And it creates kind of a pathway or a circuit. And this reward pathway or circuit, okay, makes it easier to remember and repeat again and again and again. So this weekend, I had a great weekend. I was out in the woods. I had a ball. I was spent time with friends. And I couldn't help but think about this talk and think about how, as a lifelong person who finds solace in being in the woods, my dopamine pathways were firing, going, I'm in the woods, I'm in the woods, I'm happy, I'm joyous, okay? My social pathways, I'm with friends, we're firing like crazy, okay? And that's all dopamine mediated, okay? So then the question is, okay, what does, my walk in the woods and dopamine have to do with drug abuse? So when you take drugs, okay, your brain is triggered to release tons of neurotransmitters at once. And your dopamine system goes, whoa, something really, really important is happening here. We have to set up a special circuit, a special pathway for this. And it creates a reward circuit specifically for that drug. But the problem is the difference between normal stimuli like a walk in the woods, social event, good meal, is that it's like the difference between whispering and somebody shouting into a microphone when you're doing drugs. And your dopamine system hates that. It says, wait a minute, too loud. So it cuts out some of the dopamine receptors until you have fewer and fewer receptors, and you no longer can experience normal rewards. A nice meal, socializing with friends, whatever it is, you get nothing because you don't have the dopamine receptors. The only time you have a pleasure surge at all is if you're doing drugs. So basically, your brain and your pleasure center, if you will, is hijacked by the drug. So the person who misuses drugs eventually winds up feeling completely flat and unable to enjoy things that previously were pleasurable, because the brain has turned the volume way down on the dopamine. So the person has to keep taking drugs in order to just even feel normal. And in order to be high, you have to take more because the brain has tuned down the volume on the dopamine receptors. So that's the word tolerance that you've heard of. So tolerance is when you don't have enough dopamine receptors left to experience anything but a big surge of drugs. So mostly that's the important circuit that I wanted to kind of talk about a little bit, but there's a couple other things that are really important that are going on inside of the brain. So the dopamine system, but then there's also kind of this anxiety irritable system. in your brain, a place called the amygdala. But anyway, but that irritability and anxiety system is becoming more sensitive while the pleasure center is becoming less sensitive. So you become increasingly anxious and irritable over just the littlest thing until you're overwhelmed by this anxiety and you have to take the drug in order to just calm down enough to be normal. If that's not enough, meanwhile, your frontal lobes, where you're supposed to have some reasoning, impulse control, thought, gets unhooked from the whole system. So it's just anxiety, irritability, and pleasure, screwed up system that is running your brain and basically chemically telling you have to do drugs and you have to do it now. So I know this all sounds pretty complicated, and it really is complicated. It's just fairly recently, since we've understood more and more about neuroscience, that we've understood some of this, and we're just scratching the surface. We're still learning so much. But so why is it important for us to even talk about any of this or know about it? Why is it important to know that there are circuits and pathways in our brain for pleasure, anxiety, and impulse control that have been hijacked? It's important so that we quit punishing people that are drug addicts. They're not criminals. We don't need to shame people who are drug addicts. This is a medical brain disorder that affects the brain and chemically causes the changes in behavior that we see. Like when Joey talks about little John being so screwed up, she knew his behavior was wacko, but she didn't know what was going on. And it was because his brain had been hijacked by the chemical. So, and it's important that we can use the science to guide folks compassionately into meaningful recovery. These aren't bad people. These are regular people who are sick, who need to be treated in recovery in order to get well again. So one of the big scientific discoveries that we've found is that is a successful use of medications. So we've figured out there are some medications that we can use to help people with their recovery. You've heard of the meds: methadone, Suboxone, bupropion, and all of those are medicines specifically to treat the addiction disorders. They're not crutches, they're medications. And we need to continue to use those. Another one of my favorite images from the science is there's some brain images of PET scans. And there's an image of a normal brain, and we're imaging their dopamine receptors. And there's a whole rainbow color of dopamine receptors in that normal brain. Then the guy on meth, and he's just got some kind of washed out pale yellow. He's got nothing going on. He isn't going to experience any pleasure unless he does meth. And then 14 months later, the same guy, after not being on drugs, all of a sudden, he's starting to get some color back. Holy cow. How cool is that? Your brain can actually recover some of those dopamine receptors. So we have to think about recovery, though, in longer terms. 28 days, okay, they got it, we're done. No. I mean, it takes a year or 2 years for people's dopamine system to return. So we have to be patient. We have to be creative. We have to treat people for more than 28 days. Science also explains some stuff about relapse, which is a really hard piece of recovery that happens often with addicts, and families and addicts themselves all are frustrated by this problem. But again, it's not the person's lack of willpower. It's that their brain has been kidnapped by the dopamine reward circuits, and they are given bad messages to the addict.
Wow, that's really cool, Heidi.
Yeah.
Is there somewhere, if somebody wanted to look at this and research this more, is there somewhere that you could point them to, like online or
One
anything?
of the places that I love is the NIH, National Institute of Health, NIH, addiction, the science of addiction, NIH science of addiction.
Because that's some really powerful stuff, and to understand that it's not always just a willpower thing, it's not always somebody's choices, and I think it really speaks to the understanding of needing to have early intervention. And so, like me as a parent of 4 kids, to be involved in my kids' life and to understand what they're going through and be there as a sounding board for them, and so that we can have early intervention if something does go south. I think that's a huge element. So thank you, Heidi. We're going to come back and we're going to ask some questions at the end. Next up, we have Evan Toonstra. Evan is a licensed independent clinical social worker at Scenic Rivers in Bigfork, Floodwood, and North Home clinics here in Minnesota. Evan has been working with individuals with addiction since 2014 in both inpatient and outpatient settings. He graduated with his master's in social work in 2016. Welcome, Evan.
Thank you. I appreciate the introduction. Excuse me. So today I wanted to kind of walk through the recovery process. I have a lot of people that will come in for appointments that will talk about their struggle with addiction, and I wanted to kind of walk through that process like I would for someone coming in for a first appointment. So, I mean, hearing all this today, you might hear something that makes you start to realize, wow, I'm really struggling myself. I might want to get some treatment. And I'll let you know that that's fantastic because you've actually taken the first step to recovery. If we're going to make any change in our life, the first thing we have to do is just recognize that there is an issue. The way AA puts it, the first step is admitting we are powerless over the addiction and that our life has become unmanageable. When we really reach that point where we decide that our life is not okay to keep living the way it is and these problems are getting too difficult to manage, we then need to make a decision and commit to changing it. Because we keep doing the same stuff we're doing, we're going to keep getting the same results. When we decide that it's worth the risk and the difficulty of changing, you become something very difficult to break, which is a committed person, and you begin your path. The next step there is to actually make a decision on what are we going to do about this problem. Which direction are we going to go with our sobriety? A really good place to start for people is just to come in for an appointment and see a therapist. Such as myself, people come in even just for one appointment. You don't need a referral. You don't need to commit to multiple appointments. You can just come in and we can just make a plan and figure out what we're going to do next. I can help with referrals and all that. And that can be a really good first step for people. So for most people, if you want to get into chemical dependency specific treatments, we do what's called a Rule 25 assessment. And the Rule 25 assessment is something developed by the state of Minnesota. It's basically like the standardized way that we show how substance use is impairing a person's functioning. And so it's about a 2-hour interview by someone specifically trained in addiction. They're very non-judgmental. I can promise you they've heard it all at this point in their careers. And, you go in and you just honestly share about your life. They walk through 6 different domains and just look at how addiction is impairing your functioning. And then they make a recommendation based on that. This is necessary for most treatments in order to be able to get in. So this is something that can be provided at any treatment center, such as like Northland Recovery in Grand Rapids. So now that you kind of know what a Rule 25 is, 25 assessment, I like to go over the 3 levels of care that are most common for people. The first being peer-led support groups. These are like your AA or NA or Celebrate Recovery type groups. These are groups that are led by peers, so no trained professionals. Everybody's somewhere in their own recovery. They typically meet weekly. I know in Bigfork there's a Sunday night and a Tuesday night group, I believe, for AA. And so they get together weekly and discuss. Usually they have a topic or a speaker, and there's time for discussion as a group about these topics. The really cool thing is it provides a very easy to join group. You don't need to do any extra work to get there. You just show up, participate, and it gives you kind of an accountability, because you know if you were to have a relapse, then you have to go to the meeting and admit it to people, and it can be really a great support for people. It's also a good opportunity to learn from people who've been sober longer and learn what they're doing to maintain their sobriety. They also oftentimes will have a mentorship type program, such as like an AA sponsor, so that you have a person you can reach out to when you're at risk of a relapse. The second level, it's a little bit more of an intensive program. This is an intensive outpatient program. Now, this is something through a chemical dependency specific organization, and it's led by professionals trained in addiction. Typically, you would meet 3 to 4 times a week, and it's usually time limited to 6 to 8 weeks. It's a curriculum you go through, so it's kind of like a class. You go and they teach you skills on how to manage your addiction, how to stay sober, basically preparing you to be able to live that life that's fulfilling and sober. You oftentimes meet with an individual counselor as well, because as we all know with addiction, there is no one way to get to sobriety, and everybody's, what people need to get sober is different for each person. So it's important, it's individualized. The highest level intensity is what's called inpatient care. And inpatient treatment is a facility that you actually live at. So it's a residential treatment. Typically it can be 1 up to 9 months. The really fantastic thing about this is because you're living there, they're able to control what substances are entering the facility, and they're able to do drug testing regularly. So this is really great for people that are struggling to stay sober in their home environment. Sometimes we can go and get really excited about our sobriety and really motivated, but then we get home to our home environment where the same stressors are, and then we fall back into old habits. So this is a way to step out of that, make a plan, and then be able to re-enter your home environment safely. It's also great for people that have had multiple relapses in their life. And so now that we've talked a bit about some of the more common treatments, obviously there's quite a bit more options there. I want to go over building blocks to a successful recovery. And to start this out, I really want to talk about connection, because at its core, addiction is very much a disease of connection. People, as a creature, we are just designed to want to connect to one another. We make friends, we make family. That's kind of what we do. And so addiction can be a replacement and a numbing to a lack of connection. They've actually done research. If you take a mouse and you put it in a cage with food and water with drugs in it, they'll drink the water until they die of starvation. But that same mouse, when it has access to other mice and activities, will actually choose the other mice over the substance, because the mouse has quality of life then. And so one of the biggest risks for a relapse is when we start isolating, we stop connecting with people. This can be friends, family, having a therapist, having a group we attend, but just having those people we can talk to when life gets difficult, so that we're not left to our own devices, because that's when we're at risk of relapsing back into those old habits. A lot of recovery is just about developing a life that we don't want to escape, because addiction is a way that you can experience joy and happiness in a fake way that isn't real, in order to escape the difficulties of life. That's what makes it so difficult to stop, because all I do is I take the substance, I feel better for a moment, but you're actually robbing your future happiness. And so the goal here is that you have a life that you actually want to be present for and you enjoy. So this can be taking care of your physical health, so you're not having chronic pain, your emotional health as well. A lot of people will fall into addiction because they're just trying to cope with their own mental health symptoms. A lot of people will struggle with, especially with like depression and anxiety, a lot of substances really help manage those symptoms. And without the correct treatment, they self-medicate with pretty severe side effects, obviously. And this may all sound pretty overwhelming to someone, especially someone that's really new to their recovery, but the fact is addiction really just starts with that first step. You know, it can be as simple as making one phone call or going to one meeting, but when you consistently are making those steps, you're going to make progress. And with that, there's going to be relapses, there's going to be difficulties, but all of that can be learned from. A relapse is just an opportunity to learn from it, get back on our feet. So I really hope hearing this is helpful for people, and yeah, and I appreciate having the time to be able to share this. Thank you.
Thank you, Evan. So that's a really good just overview of what the recovery process looks like. And so some of that isn't new to me because I had the privilege about a year ago to go through a program called Mental Health First Aid and become a certified instructor with Mental Health First Aid. So just, I realized that I didn't introduce myself at the beginning of this whole thing. My name's Brian Boone. I serve a couple different roles in our Bigfork area in the edge of the wilderness here. First of all, I'm a family guy. I got a wife and 4 kids, as I already alluded to. I pastor Bigfork Assembly of God in Bigfork, Minnesota. I wear the hat of mayor in town right now. And then, of course, as I'm leading into, I'm a mental health first aid instructor. And so mental health first aid is a really powerful program that can help us understand how to, as a normal everyday guy, how to go about helping somebody. I've been a pastor now for I think 16 years, and I never was fully trained in anything related to mental health. And so if I'd have somebody come in and sit down and talk to me, I really didn't know what to do. And really that's the experience of probably 90 to 95% of people out there, that they just, how do you deal with somebody who's hurting? And what do you do? How can you process through that? And so one of the things in our culture, in our society, is more that, and mental health as it pertains to addiction and recovery, is more than 115 Americans die from opioid overdose every day. And so that's a huge issue. And why we've heard a little bit about the brain chemistry behind things. We heard Evan just talk about taking that first step. And I think it's important to understand that this started with one step in the wrong direction, and healing can start with one step in the right direction. And part of the expansive problem in our country, however, is that only about 10% of people experiencing a drug use disorder receive specialty treatment. And so how can we as a community identify, understand, and respond to signs of addictions and mental illnesses? What can we do? How can we approach this? And how do we gain an understanding of this? So in a nutshell, mental health first aid is the initial help offered to a person developing a mental health or substance use problem or experiencing a mental health crisis. So the first aid is given until appropriate treatment and support are received or until the crisis resolves. So MHFA is traditionally an 8-hour course. They're doing some things with technology to help try to reduce that number, but it's an 8-hour course. So it's not meant to give you a license to go and diagnose somebody and say, oh, you have depression, you have anxiety, you're schizophrenic. That's not what it's about. It's about being a friend to somebody. How do you be a friend in a healthy way to somebody who needs that help? And so what do you learn in mental health first aid? First of all, you learn risk factors and warning signs of mental health and substance use problems. And so you go through and you process through what those look like. You get some information on the different the different disorders like depression, anxiety, trauma, psychosis, and substance use. We talk about how when, even if somebody isn't diagnosed with an issue that, I don't know if you've ever experienced some anxiety in your life while you haven't necessarily been diagnosed with anxiety, or you've experienced a traumatic event that while you haven't been diagnosed with a disease or anything, you're going through something hard. And so it's important to have the information on those things, but also just to know when somebody's suffering or dealing with something that's not necessarily extravagant in terms of being diagnosable, but it feels extravagant to the person. It feels weighty to them. And so we have a 5-step action plan to help someone who is developing a mental health problem or is in crisis. And so you can learn this, you can utilize it in the training. We go through and we process through how to best use it. But first of all, you assess for the risk of suicide or harm. And so you process through, is this person suicidal? Are they going to hurt somebody? And if that's the case, you reach out for help right away. You call 911, you take care of that issue, because that's something that is beyond, as a mental health first aider, that's beyond your scope of care. You listen non-judgmentally. I'm a pastor, and as a pastor, I come from a biblical worldview, and sometimes it can be really hard for me to listen non-judgmentally because I have my preconceived ideas that I bring to the table. But I've worked on learning, how do I listen to where this person is at? Not where I'm at, but where this person is at. Maybe I'm doing okay that day. Maybe it's a sunshiny day and I'm like, hey, this is great. Maybe I'm out fishing or something, and somebody's got an issue that they need help with. How do I listen to them and not make them feel bad for having an issue? Because I don't know anybody who has never had any issues in their life, right? We've all had issues in our life. The next thing is to give reassurance and information. How do we go through and reassure them that they can get through this? How can we give them proper information on steps they could take to get through this? And then we encourage appropriate professional help. It's great to have Evan with us today, and Dr. Korsted, both fantastic professional options that you could go to, and then encouraging self-help and other support strategies, just making sure that you're doing the things to take care of yourself properly, because it can be really hard when it gets to January, February, and it's 40 below to go out and take a walk. So what are some other strategies you could use to really help yourself take care of yourself and make sure that you're putting your best foot forward? So my email's there. I'm in process of scheduling another mental health first aid training for the Bigfork area. If you're out there and you want to bring me in to do a mental health first aid training, or connect with me on what it looks like, if you have an organization that could use that, feel free to shoot me an email. You can look up our church, Bigfork Assembly of God, if you need to get a hold of me some other way, or lose that email. But I'm so excited that this conversation is happening. And so now what we're going to do is we're just kind of going to open it up here, and I'll jump back on and just continue the conversation and ask some questions. And so I'll kind of get it started here. Joey, so as you were watching Johnny walk through the things that he was walking through, what did you first see that gave you hope for him?
Well, that was quite a ways down the road, to be honest. I was just so confused. I just could not understand what was going on, and it didn't occur to me till later that he was doing drugs. I mean, because you don't want to believe that. There's a part of you as a parent that don't want to admit that your child would be involved with that you know them better than that. And you know what? You don't. They're an individual and they make choices. And I think confronting that face on and having somebody tell me what was going on, honestly, was a mother of 2 boys that had seen Johnny at different places, you know, stoned. And she came to me and told me, and she said, "Do you know your son is doing meth?" And I said, "No." And she said, "Well, he is." And I just thought I better, she said, I just took the responsibility of telling you that. And I need to probably talk to her again, because I should be forever grateful to that woman for having the guts to say that to someone, because it's not easy, you know.
Yeah.
And thankfully, that was the beginning of trying to figure out what to do, but finally admitting that there was something drastically wrong, and it was methamphetamines addiction.
So when's the first time that you saw a ray of hope through that situation? Like after that conversation, what did that look like when you started to see hope, that there was a light at the end of the tunnel that you had?
Well, recognizing what it really was, because even it's just hard to believe, you know, and you don't want to believe it. And finally coming face to face with that and having to reckon with that, it scared me to death. And basically I just had law enforcement come to the school, and I said, "Get him out of here, get him out of this area, and or he's going to die or something, or kill somebody else," you know, because they get very, I don't know, they dare to do that. They were deer hunting while they were stoned on meth with, you know what I mean, rifles. I mean, when I heard that, it was like, oh my gosh. So I knew something had to take place or something worse would happen. And ultimately, that he was taken in by law enforcement. They put him someplace safe until I could get him to a rehab center. And he went through the rehab and stayed there, and then went to a halfway house, and he recognized himself that that wasn't the place for him. It was a little bit too loose. And so we brought him home, and he's been sober ever since. So, I mean, it's a God thing. Yeah. A lot of prayer, let me tell you. Yeah. So, yeah, we were just very fortunate to have him back, and he's been great ever since.
Yeah,
and I'm really sorry he didn't.
There is hope.
There is hope. Yes, there is. And I think that's part of the thing, is don't give up, because there's so many lies that are going on in between to cover up for the behavior, that you have to be brave and consider what the possibilities are, and dig for the truth, however that might be.
I think that's really interesting that you described the kind of the first time that you experienced hope was when you were able to take the steps necessary to see him move towards his recovery, even though that had to be a horrible thing for you as a mother to go through, calling the police on your own son. Mm-hmm. and just that whole, the mind games that would come into play there, but that was really a source of hope for you, because you knew a step that you could take to help him now. And
I didn't know what to do. Yeah. I remember him saying to me when I called our community officer, and he said, Ma, because he was still agitated and whatnot, you know, and he said, Ma, what are you doing? What are you thinking? He said, why are you doing this to me? And I said, because I love you. Yeah. That's the only, you know, I don't want to see you like this. I don't want you to destroy your life. Yeah. And somehow it worked. Yeah. Thank goodness. And he's been just super ever since. Yeah. So there is hope. And I think, David, you must kind of relate to this. There is hope. You know, it comes in different directions, but you can't give up on them.
Oh, yeah. No, you get random little bits of hope, and I think that's what is so strong in keeping somebody on the road to recovery. You know, you have your basic time milestones like, oh, I made it a week clean, or I made it a month clean. But then you have other stuff like, oh, I paid off all the minor credit card debt I racked up while I was using. oh, I've, paid this bill. Oh, I've gone to this many family functions. It's little bits of hope that keep bringing you back and going, yeah, I need to keep being clean and sober. Because when you're using, all your little bits of hope are just, oh, I can get another hit in an hour. Oh, I can get another hit in an hour. And it's better to look forward to little bits of lightning hope than clearly the little bits of drugs or whatever you're using.
Yeah. So Dave, when did you realize that you had a problem? What was the point that you were like, I've got something that I need to deal with here?
Oh, well, I mean, I think, I would hope that most people using figure it out pretty early that it's an issue, whether or not they're ready to stop. When I made the transition from, it's funny that they gave me 3 refills for this Percocet for some kidney stones, when that changed to, oh my God, I only have 1 more refill of Percocet, and then I got to figure out something else. That was when I figured out I had a problem. But you make up a lot of, or at least I made up a lot of excuses, and, it was never an excuse like, I'm so depressed, I need to take pills. It was, I got to keep working these 2 jobs, so I need to deal with the physical pain I'm getting from that. But I wouldn't have had to work those 2 jobs if I didn't have a substance abuse problem, that kind of thing. And like I said earlier, the point at which I ultimately was like, I need to change this right now, was just waking up one morning, and I think in Alcoholics Anonymous, they call it a moment of clarity. But waking up and going, I'm tired of puking for an hour every morning. I'm tired of scrounging every day to figure out when I'm going to get my next, pill or my next joint or my next whatever. And it wasn't really affecting my family because I didn't live near any of them. And if it was, I was blind to it, outside of me not going to visit as often. But yeah, I think the moment for me was just I had like 4 weeks in a row where I was averaging about 2 hours of sleep every night. And I was coming towards the end of a quarter of college that I ended up dropping out of before I got clean. But just with finals coming in and 2 jobs and blah, 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 it was kind of a compounding of everything falling in on itself. And like Dr. Corson was saying earlier about making your dopamine receptors less and less reactive, you get to a point where I'm like, there's no amount of these drugs that I can take in succession to get me where I want to be mentally. But then knowing through stuff like this and, DARE programs and whatever other after school specials I've seen throughout my years, you go, I know if I can stop this and just go through a cruddy period that I can come out of it and be fine again. And that's that bit of hope we were talking about, where if you can see the light at the end of the tunnel, it's a lot easier to walk towards it. And I think that's the big thing.
Yeah. So who was the first person that you were able to reach out to when you were in recovery? How did that look, and what power did that have as you reached out to somebody and actually talked about the problem you were having?
Comically enough, and I'm one of the lucky cases, it was my cousin that I was living with who was also a heavy drug user, and he didn't stop when I stopped, and we still lived together for a while, in and out of the car and stuff. But it was just, I came to him and was like, here's the rest of all my supplies. I'm like, I need to stop. I just need you to keep this away from me. And you develop a weird little relationship with codependent, somebody co-using that you're living with, where he's like, I'll keep it for you until you need it again. And it's like, no, I need you to take it and dispose of it, whether you toss or use it, whatever. But I just need somebody to know that I recognize this problem and that I'm working on it without telling everyone else. And then it was maybe another 2 months before I talked to, my family, and I'd made a big Facebook post saying, hey, this is what the last 3 years of my life have been. I don't know what the next 3 years are going to be, but I do know what today is going to be.
Yeah.
Huh.
So
that had to take some courage to talk to your family.
Oh, no kidding.
Yeah. Well, and luckily for me, I have on both sides of my family, there's a lot of a lot of drug use problems and a lot of alcohol use problems. So it was just like, "Hey, all right, I'm the next one, and that we're all going to talk about this Christmas." Yeah. So hopefully one of the last ones, you know.
Yeah.
I sure am glad you came, Dave. Thank you so much.
I am too. Yeah. You know, like I said, I had to get out of the area, so I moved to Minnesota and met my wife once I moved here and decided to stay. It's been better ever since. Might as well keep staying.
Way to go.
Yeah.
Way to go. So Dr. Korstad, what are, you talked about kind of how the pathways kind of get formatted. There's sort of like roadways in your head that the dopamine sets. What are some things that people can do if they recognize that, to start the process of retraining their brain into the new pathways, into the healthy pathways that they need to go back to?
Yeah, and it's tough. I mean, when you get those pathways established, you keep them forever. But just again, my woods analogy, just like, you know, walking down a path in the woods, if it's a well-worn path, you can keep walking there and walking there. But, you know, if you can get into a successful treatment, or like Dave talked about, focus on, I'm going to brush my teeth at, you know, 7, at 7:02, I'm going to have coffee at 7:04, you know, whatever it is to keep you off that path. At some point, it winds up kind of growing up with a bunch of stuff that, you know, you get some weeds and some branches across there, and the more disuse those pathways have in your brain, the easier it will be to stay clean. And but it's tough. It's definitely tough, and that's where, you know, treatment programs are huge. And whether it's like Evan talked about, you know, peer groups or AA or outpatient or inpatient, and then to be patient long enough to see that pathway all overgrown with junk and you don't walk down there anymore.
So as a clinician or doctor, what would be the picture of hope that you'd like people to see?
You know, I mean, there is huge hope. One of the things that I find fascinating is statistically, we get pretty wound up about relapse. And I'm not downplaying the fact that it's a devastating, difficult problem. But when you look at medical problems, you look at hypertension, you look at asthma, I mean, those people relapse all the time. Quit taking their meds, their blood pressure goes sky high, quit taking their med, they're short of breath, they're in the ER. And statistically, relapse doesn't happen any more often for drug abuse people than it does for asthmatics and hypertensives. And yet we don't shame them, you know. I think the biggest thing is we have to have it in our brain that this is a medical problem, and quit thinking that it's a law enforcement problem or a willpower problem. And that's going to be that's a big piece of help, I think.
So as somebody who isn't as familiar with the differences between like what you did for years as you're a family practice physician, right? And so or Evan's role as a clinic, I'm looking for it here. I can't see his letters even on this screen, but as a
we'll help you out. Social worker.
Yeah, social worker. There we go. Thank you. But if somebody's in a spot where they don't know where to turn to, why is it important for them, Heidi, to talk to their doctor about what's going on?
Absolutely, sure. And we do a lot of stuff very similar to what Evan talks about in terms of looking for the right treatment programs, finding getting them set up for a Rule 25, doing those sort of things. But also, it's super, super important for us to keep drug addicts alive long enough to get them to treatment. And that's another big place where medicine comes in. And the statistics you quoted about how many people die every day in the United States from drug overdoses. We have to be willing to do harm reduction. We have to be willing to have Narcan available. We have to be willing to take somebody to the ER when they're overdosing, even if, we don't want to do that because then people are going to know. That's where we need to, you can't intervene on dead people.
Yeah.
And you have to start that first step.
Yeah.
And another one besides what Evan said about coming, that, in our county, first call for help, it's a great place. 411, 411.
211.
Or 211.
Was it 211?
211. 411 is information. Yeah.
Oh,
211, first call for help.
211, sorry, thank you. 211, first call for help. If you don't know what to do, you got somebody that you think, are they overdosing? Are they just tired? Are they this? Are they that? Get help. Come to the,
Yeah. If you have a problem and you realize that you have a problem and you're looking for somewhere to turn, you can call 211. If you have a family member or a friend or a loved one and you're trying to figure out what to do, you can call them. They'll put you into contact with resources that can help you out. It's a huge resource for us. Especially up here in the north. Thankfully, we have people like Evan that are up here now, and I know we weren't able to have Jeff Olds join us, but in Bigfork we got Jeff Olds as another licensed social worker in the Bigfork Valley system, and so it's just really good to have those guys available. So Evan, question for you. We've all heard about the idea of an intervention. And I know that's something that's in the back of people's minds when they're thinking about, if my family member ever had a problem, I'd have to do an intervention. Can you speak to either the effectiveness or ineffectiveness and who you would talk to for support if you're trying to help a loved one deal with their problems?
Absolutely. I think so interventions can be really helpful when done well. The difficulty is a lot of times they're done improperly, or people aren't quite prepared for it. So an intervention is seen as the absolute last step in a process of helping someone with their recovery. And what it means is you as a group of people get together and say, this person's behavior is hurting us and it needs to stop, or we are actually going to leave their life. So you need to go into an intervention prepared to set some very firm boundaries. Mm-hmm. And so what's really important is that, let's say you have someone in your life that's struggling with addiction, probably the first step is to you yourself figure out how their behavior is affecting you and start setting those boundaries, but also conveying to them how much you care about them and want them to change. Sometimes that can be that first step for them. If you just sit down with them and say, hey, I can see you're struggling, you're using this substance, and this is how it's affecting me, and I'd really like to see you do better. It can start as small as that. But if it's over a period of time, because the difficulty about addiction is it kind of climbs your Maslow's hierarchy. So we all have priorities in our life. And addiction climbs itself up to the very, very top, and it kicks family, it kicks friends, kicks everything out of the way, because that is your only way to feel those happy chemicals. And if you don't have that, you're feeling miserable. And as much as we care about our family, we still will do things that hurt them. And the family needs to take steps to protect themselves as well. And so really that's where the intervention comes in, is letting them know that it's reached a point where the relationship has become destructive for their well-being. And so that's where it's really important that they reach out to like myself or Jeff or what are LADC's, licensed drug and alcohol counselors. They can be really helpful as well. And so interventions are really important that they're done with a lot of preparation. Yeah.
Cool. That's important for us to understand, because I know I've heard about interventions. I've heard that they can be helpful, but they have to be done right. And if you don't do them right, it can sometimes cause more harm than good. Because like you were talking about, if you're going into it and you're not willing to set those boundaries, or you set those boundaries and you don't stick to them, then the next time you try to set boundaries, it's gonna be questioned. Can you speak to, like, I know in Bigfork Thursday nights we have an Al-Anon group that meets for people who are watching people go through these issues. Can you speak to the importance that if you are somebody who isn't directly addicted to a substance or isn't directly affected by that, but that someone you love is affected by that, the importance of you getting the help that you need while you're trying to be that support individual?
Oh, absolutely. The really difficult thing with addiction too is it's kind of like the elephant in the room. And especially if you're part of the family, families love homeostasis. Like, we don't want things to change. So we want that balance. So let's say a family member starts using, everybody needs to accommodate the use, because say dad's not going to work because he's drinking too much and then he wakes up not feeling well. So, mom's got to call into work and explain that he's sick so he doesn't lose his job. The little things like that start to happen. And suddenly we're all accommodating and preventing the person from experiencing the consequences of their use. And what happens is we get what's called codependency with the person with the addiction. And the sad part is it really comes from a place of love. We care about the person. We want them to get better, and we don't want to see them suffer. So we prevent them from experiencing the consequences of their addiction. And without trying to, or without intentionally, we end up actually enabling their behavior. And what it does is we get caught on that roller coaster with them, because for us to feel okay, we need them to be better. And for them to be better is something we can't control. So the days where they're not using, we feel really good, but then they relapse and then we're down again. And so if you're finding yourself in that kind of situation, that's where it really is important that you take that focus on yourself. It is not unloving to put yourself first in a situation like that. Because if the boat's sinking and you sit in there and you're trying to paddle the water out, well, he's drilling holes in the boat, you're both going to sink. Sometimes you have to get out of the boat and get to your own boat before you can help them. And but it's a really, really difficult thing, because it all comes from a place of love. And you can love and care for someone and allow them to continue with their bad choices. You obviously don't want to encourage a behavior. You can challenge them, but at the end of the day, you need to make sure you're okay.
Yeah, I think the analogy that comes to my mind, if I'm hearing you correctly, is like when you get onto an airplane. I know none of us are flying right now because of COVID, but when you're on an airplane and they're going through their spiel and they say if we lose cabin pressure, this little mask is going to drop down, and before you help the person next to you, make sure that you put your mask on first, because if you pass out, you can't help the person next to you or yourself, and it's going to be more of a liability for those other people on the plane, more of a hassle for everybody else if you don't make sure that you're taken care of and you're approaching things from a healthy place. That's good. And Dr. Korstad or Evan, or maybe it'd be good to hear from both of you on this, but can you give us an idea of why substance use and mental health go hand in hand?
Yeah, I can definitely speak to that. I think a lot of it is there's a lot of similarity between certain substances and things that are prescribed, actually. So alcohol is a very effective anti-anxiety medication. It just has tremendous side effects and it's highly addictive. And so what happens is if you don't have adequate access or you're not managing your mental health, we seek out substances. It's actually very helpful diagnostically to know what someone struggles with, because like methamphetamine is very similar to medications that manage ADHD, you know, and so a lot of times what happens is people are they're just trying to get through the day. You know, if you have crippling anxiety and you discover that, oh, when I have a couple beers, suddenly I feel a lot calmer, you know, that's how that stuff starts. And the really hard part is, as soon as you stop using that substance, that whatever mental health symptoms you're struggling with get 10 times worse for a time. And it just kind of perpetuates itself. And a lot of it is just not having the skills or the access to resources to manage it.
Dr. Korsted, do you have anything to add?
Yeah, really very well said. Yep, and a lot of people get into trouble with drugs and alcohol by self-medicating their anxiety or their depression. Absolutely. But then, like we talked about, with the anxiety system that gets kind of screwed up in the dopamine system, which is pleasure. The flip of pleasure, of course, is depression. You know, a lot of addicts, after they recover, really struggle with depression or really struggle with anxiety more than they did before they were addicted even. And all of that is because the chemicals are similar.
So I don't know if there's any other questions that anybody else has for any of the fellow panel here, or but we can keep talking, or if there's no other questions, we can wrap it up. But
Okay. I just want to say something about Dave again. I just got to know him because he works at Bigfork Valley at the nursing home, and I have never seen a happier. Every time I see you, Dave, you make me happy because he's singing and dinging around, you know, and just having a gay old time. And so I'm just so proud of you. You're just a great human being. So keep it up.
Sure. I'm a product of my surroundings.
Okay. Well, you make my day every day because you're always happy. Go on. Oh, thank you all for participating in this. I think this has been really interesting. And like I say, if it helps one person, it's worth it.
yeah.
So
Yeah, and I just want to say, Joey, thank you for pursuing this. And I know there was some times that you were questioning just with how you process things, of should I even keep going, and thank you for continuing on and pressing through and making this happen. It has been a fantastic conversation. I trust that it's gonna be a help to people, and a resource for people as they move forward.
I sure hope so, and thank you. Thank you all for participating. It's been really good, I think. So, okay.